Hi, this is Dr. DRKIMDERAMO from the American Institute of Mind-Body Medicine, and I want to welcome you here for this series of videos I'm doing before the webinar I've created for healthcare practitioners. I've been practicing mind-body medicine for decades, and I'm trained as an emergency medicine physician. That's my board certification. So I've sort of had the whole gamut of sort of the extreme of tertiary care, major trauma, and also the true preventative medicine that I've practiced with mind-body medicine, where I've actually seen patients reverse disease, no longer need medication, no longer have an autoimmune deficiency or migraine headaches or metabolic problems, gut problems, fill in the blank. I've seen people heal when it might seem like a medical miracle. And having this understanding of mind-body medicine has helped me not only to heal myself of a severe chronic illness doctors told me I'd need medications for indefinitely, and to help my clients and my patients reverse disease, get off medications, reverse things like anxiety and depression and autoimmune illness, chronic pain, things that have been conundrums for a lot of doctors for decades. But I've also really been able to dig into the research behind mind-body medicine so I could share it with other practitioners and other physicians in ways that help them integrate it into their clinical practice as well. So I want to share with you some of the basic principles here of how your mind and body are connected and what we can do to create change that resolves physical illness. Now, if you haven't seen the first video, definitely go back and watch that. It's relatively short, but it will give you a really good overview of the three main principles of mind-body medicine and how we are connected as a whole and how you can help ignite healing for yourself and for your patients or clients. In this video, I want to share with you how the mental and emotional systems, you can think of them as the mental and emotional bodies, affect the physical body. One of the things we see a lot is, we have the physical system up here, and in conventional medicine, this is typically what we're looking at. We're looking at that skin change, the rash, or we're looking at those lab results and the diabetes, or we're looking at the autoimmune disease and what's happening in the immune imbalance and the immune components. We're looking at the physical symptoms, and we're trying to get to the bottom of what's really going on and treat it. Often we use, medications, surgery, or other interventions or procedures to try to correct things at this level. And as we all are aware, it's a pretty depleted system. We're spending billions of dollars we don't have trying to help keep people get better, and our country's actually become one of the sickest adult cohorts in the history of the world. So what are we doing wrong? What are we missing? We're actually failing to look at these levels that are beneath the surface. What's happening emotionally, which, as I talked about in video 1, our emotions, we've seen in so many clinical studies that chemically our emotions affect what's happening physically. Our emotions are chemical states. They're chemical reactions in the body that affect our heart rate, our blood pressure, our respiration, all of our physiologic processes. And depending on what emotional state we're in, we actually get into a healthier physical state, or we get into a more diseased state, physiologically and chemically. So we're really seeing a lot of how our emotional system affects things physically. And in fact, this is one of the most powerful things that affects what's happening cellular. So I'm going to put a big arrow here. And yes, medications affect what's happening physically. Getting some exercise, changing your diet, adding supplements, doing surgery, it's all going to affect what's happening physically. But the biggest impact, moment to moment, second to second in your patient's life, in your body, is what your emotional state is. That's going to determine how you feel physically and what your cells are being fed. Are you even absorbing that all organic, high nutrient diet? Or are you in a lower emotional state of anger or fear where you literally change your autonomic nervous system activity? You change the blood flow to the gut. So now, even if you're eating the best meal in the world and the best supplements in the world, you're no longer absorbing nutrients. You're no longer breaking down your food. You're no longer adequately detoxifying and eliminating waste. It creates a huge problem, and then we keep trying to do more and more at the physical level to change the diet, add medications, do some lifestyle changes. Nothing has a more powerful effect on what's going on in the body physically, moment to moment, second to second, then your patient's emotional state, then your emotional state. Now, what's happening mentally? Same thing we've seen. Our thoughts have a huge impact on how we feel emotionally. So I'm going to put another big arrow here. Very, very powerful effect. And I want to help you experience this right now in this video. So the thoughts you have, we've seen, change the nervous system firing in your brain, change the neurotransmitters that get secreted into your bloodstream. They're going to change the way you feel emotionally and, of course, have a physical effect, even down to the level of your genetic code, changing which genes get turned on, which genes get turned off, even if that patient's carrying disease and they can never manifest that disease if they stay in these healthy chemical states. So let's do this little exercise here. I'm going to have you close your eyes if that's available to you. You're not operating any heavy machinery. Take a deep breath and just close your eyes. And I want you to just change your thoughts. You're going to have some thoughts of, you just take a deep breath and slow yourself down first. So just practice having these thoughts. My life is so hard. I'll never make it. I have way too much to do. I have so much ahead of me. How am I ever going to keep up and make this work? And just see if you can absorb some of those so that the thoughts kind of get down to the cellular level and do create that emotional change. So just take a few deep breaths. I'll never make it. There's so much to learn. I have to keep learning more and more and more. Maybe your practice is hard. Maybe it's getting harder every year. I have these patients and they're just a conundrum. I don't know what to do. And just let that percolate for a moment. Take a deep breath. Okay, and then just let it go. Relax your body. Now I want you to compare that and how you felt to close your eyes again, and I just want you to relax your body and tell yourself these thoughts. Life is on my side. It's okay for me to let things go. What if things became easier for me and I didn't have to do it myself? What if I could learn to tap into my body's wisdom and to help my patients tap into their innate wisdom and create miracles in my life, something really different beyond what I've seen before, have an exhilarating life and exhilarating practice. And just start to feel these thoughts, right? So you can think more positive thoughts. I'm in charge. I can make change. It's okay. Life is on my side. And just breathe all those thoughts in. And then let yourself go. And I want you to just share with me, share with yourself, did you have a change in your emotional state? Did you feel more uplifted the second time? Did you feel more maybe hopeful, more encouraged, more inspired, a little bit lighter? Your thoughts have a direct impact on how you feel emotionally. So shake that off and take a deep breath. Now, the fact of the matter is most of our thoughts are subconscious. And you can think about, oh, let's just try to have more positive thoughts. I shouldn't be so negative. And that's what I did when I had that autoimmune disease. I tried to be more positive. I tried to use mind over body, and I had no idea how to really apply mind-body medicine for myself. So I basically had to figure it out because I was so committed and determined to healing my body, to not going on medications, to not giving up the lifestyle that I loved. And like I said in the first video, it was days. I was completely symptom-free. Why? Well, I was actually not only just thinking positive thoughts, I actually learned how to tap into that subconscious system that's running your thoughts on autopilot all the time, and to make real foundational changes, like ground-breaking changes, not just on the surface, right? Like we're trying to make changes on the surface. Let me just think more positively. We actually need to slow the brain down enough to input new information and release the old records that are playing. And in the next video, I'm going to talk a little bit about that and one of the main mind-body tools that I've used to do that, to have for myself personally and use with all of my patients, even people with chest pain and shortness of breath in the emergency room. In just 4 minutes, get them out of pain, bring the heart rate down, bring the oxygen saturation up, bring the respiratory rate down, and get these real physiologic changes very quickly. Now, if I can see that happening for someone in the ER, it's pretty much universal how we can begin to apply this practice. Now, one of the things we see is, yes, your physical changes do have an effect on how you feel emotionally. Go and get high, throw some chemicals on board, you're gonna feel good. But even things like medication or changing your diet or going for a run, it's gonna change how you feel emotionally. How you feel emotionally is gonna change what kind of thoughts you're having. I had listened to a great story. It was by Gay Hendricks. I actually put this in my book, The MindBody Toolkit. He was talking about, taking this bike ride, and he's riding out on the way out, and he's having all this joy, and he felt really good, and he rides by his friend's house, and he thinks, wow, I really love this friend, and he's on his third marriage, but God love him. He's trying again. He's going for it. He still believes in love, and I really appreciate the time I can spend with that friend, and what a guy. And then he's like 3 hours later coming back the other way, and he started driving by the same guy's house, and he's like, what a louse. The guy's on his third marriage. What is he thinking? I mean, how do you mess it up so bad? Can't you figure your life out? I don't know if I want to hang out with that guy. And then it just boom, hit him wow, my physiologic state is totally affecting my thoughts. It's affecting my brain. It's changing the way I feel about this person and what I'm thinking. Now, so our emotional state does change how we feel mentally. You listen to a sappy love song and then you start to feel lovey-dovey about everybody. So I want you to be aware of that. However, it is infinitely more powerful. The effect that our thoughts, thousands and thousands of thoughts in a minute, are having on our emotional state. It's an unconscious process constantly running that's creating the chemical state that you're in and that your patients and clients are in, that you're trying to fix. That's going to create the physical change they're having. Not only the symptoms of fatigue and pain and low energy and digestive problems, but actually physical cellular changes. So if we can get a handle on this process and on this process and create changes here, instead of just kind of chipping away at the tip of the iceberg here, which, like I said, is really what we've been focusing on in conventional medicine. 90% of the patients I've seen, even in the emergency room, don't have a physiologic, objective issue that's going on medically. It's not a medical discrepancy. It's actually something that's deeper that's creating that. And I've been able to see people have these incredible results by applying mind-body medicine, which gets to these deeper levels. So I'm going to share with you one of my favorite tools in the next video that's really easy to use, easy to implement. It works in minutes. I've seen people get just out of severe pain that's been there for years in just a few minutes by addressing these deeper levels using mind-body medicine. So I'm going to share that with you in the next video and discuss a little bit about how it works, why it works, so you feel more confident using it for yourself and for your patients. So stay tuned for the next video. And again, I will see you on the webinar. I'm really looking forward to that. Make sure if you have any colleagues, friends that you know would be interested in this, share this with them, because this is pretty revolutionary to begin to apply this and the science behind what's happening in mind-body medicine and have a way to easily apply it in conventional practice. Sending you my love, Dr. KIMDERAMO from DRKIMD.com and the American Institute of Mind-Body Medicine. I'll see you in the next video.